Hey everybody, it's Dr. Peebler again, working another night shift here, somewhere in Florida. I think that I'm ready to tell the story. Probably one of the most important stories there is. The story of life and death, the story of health and disease, the story that I have really been trying to put together the last couple of months, just pouring through medical literature, trying to put it all together in a digestible way that I can teach fellow colleagues, teach patients, teach my own family, teach myself. I'm just as much of a learner in this process as you all. The U.S. health system, as it stands today, in June of 2023, is probably the worst I have personally seen it. The amount of disease that the average patient who comes into the hospital system with is unbelievable. As an internist, as a hospitalist, we could always kind of count on, a decent balance of complex, difficult, sick patients, and very simple cases. Within our community, the simple cases have gone away, unfortunately. The simple cases are now complex cases. Simple cases are now multiple system related cases. Take, for example, our classic chest pain rule out. 58-year-old male, female, it doesn't really matter, presents to hospital X with complaints of chest pain. Should be as simple as an observation admission, where the standard of care would be to, trend troponins over the course of about 12 to 18 hours, monitor someone on telemetry, heart monitors, look at a risk factor investigation, a very conventional risk factor investigation, but a risk factor investigation nonetheless. And that person, as long as there's no obvious issues that happen overnight, that person should be discharged the next day. Follow up with a primary care doctor, follow up with cardiology, et cetera, et cetera. Now, almost every single chest pain rule out has some other system involved. Now, that could be something simple like electrolyte disturbances, hypokalemia, hypomagnesemia, hypercalcemia, whatever. But it could have an acute renal failure component. It could have acute respiratory failure component. It could have some uncontrolled arrhythmia component. It just is never ending at this point. There's no simple cases that come into the hospital system at this point. And it doesn't really matter what part of the country it seems. I mean, I've worked at this point more than 20 hospitals in the last 6 years, and from all many states: New York, Florida, Kentucky, West Virginia, Indiana, Kansas. It's very similar everywhere. It's not getting any better, and the doctors don't have any answers, unfortunately, especially not in the acute setting. You're just not able to really dig into the drivers of disease as we should be able to, where we are getting pressured to get people in and out as fast as possible, and to have the majority of the workup, hopefully done as an outpatient, which unfortunately is also not happening because the outpatient doctors, I don't think that there's not that they're not curious, it's just that they're overwhelmed. They're seeing 20, 25, 30 patients a day. Can't imagine in an 8-hour shift, or trying to at least. So I have a lot of empathy for them, but I really am worried about the health of the U.S. population. I have been for a long time, but the story needs to be told. People need to know the truth, and people need to take control of their own health. They can't wait for the medical system. They can't wait for the medical doctors. They can't wait for the surgeons to do it for them. They have to have ownership of themselves, and that's part of the story. But part of it is they need the knowledge. The knowledge is the power, and what I want to try to do in the coming, I don't know how long it's going to take to tell the story. I want to have a sense of urgency with this because people need to know. But at the same time, I don't want to rush through this story. It's an unbelievable story. It's coming together, every day. Some of the most exciting papers and literature that I've seen has come out within the last year or two, when really some of the story is coming together and major pieces are coming together, and it's unbelievable. So I'm going to be diving in very hardcore into the mitochondrial story, the redox story, how it gets broken and how it gets fixed with normal physiology, and how we can accelerate that process towards balance and towards healing, and tipping the scales in your favor to not only prevent disease, but potentially reverse disease, major diseases. It's interesting because a lot of the mitochondrial redox literature that's out, yes, there's plenty of it when it comes to hypertension, diabetes, cardiovascular disease, but a lot of it has to do with cancer and neurodegeneration, things that I think most people are pretty scared about getting, and it is so fundamental. It deals with oxidative stress. Oxidative stress is very likely, or redox imbalance, is very likely the main driver of all disease. And, one of my mentors, had coined this term called the 4 horsemen of the apocalypse for health. And it had been centered on inflammation, chronic inflammation, insulin resistance, something he called catabolic physiology, which is basically a dysregulation of adrenal hormones, cortisol in particular, and oxidative stress. But the more I look into this, it seems as if oxidative stress, redox imbalance, is really the main driver, and the other ones come from it. But it's also a vicious cycle where the other 4 horsemen can drive redox imbalance as well, which then becomes a vicious, terrible cycle. So I have put together, as of right now, it's still growing, believe it or not, it's still growing, but I put together a PowerPoint presentation that has over 1,100 PowerPoint slides. And it lays out this mitochondrial story pretty compelling. And it's all based off of literature. Every slide has at least 1 or 2 papers from the published literature that helps tell the story. And I use a lot of pictures, videos even, and I'm going to try to narrate this the best way that I can. And I would really highly appreciate feedback, because I understand that the vast majority of the people who are going to be watching these videos are not medical doctors, they're not PhD scientists, they're not biochemists, they're not cell biologists, they're not physicists. So it's going to have to be where I get a lot of feedback, if I can, from you all to help me understand where I'm hitting the mark and where I'm not hitting the mark, in terms of helping you all understand what the literature is showing fairly clearly, at least in the last 20 years. And especially over the last 5 years has been unbelievable, the amount of just discoveries that we've been able to come up with, Not me personally, but my colleagues that are in the benches and in the labs. And it's the evidence is so overwhelming at this point that I think that if you know about this as a medical provider and you don't give it some reverence and some thought about how you can transmit this messages to your patients and use this information clinically, you are doing, to say you're doing a disservice to your patient is an understatement. And it's the minimum I would say. So I encourage my colleagues to get into the literature, find out what's out there, get curious again. I know that a lot of us in the medical profession feel very demoralized, and for very different reasons. For me, like, I am a conventional doctor in a conventional system inside the matrix who knows there are better ways to treat patients and to help people with disease, whether it be prevention or treatment. And I'm trying to navigate that, But there's some of my colleagues that are much more conventional minded are demoralized and unmotivated and, on their own, for their own valid reasons. So we need to get the spirit that, at least that took me to medical school, that question of how and why, and just wanted to know mechanisms and understand, deep levels of science in order to help patients, at least I hope that's what the majority of my colleagues went into it for. We got to get back to that, because if we aren't asking the questions, and we're not at least even open to hearing, especially if our patients are asking the questions, and we're not open to hearing them, open to discussing these things with them, open to considering what's out there, then we're just perpetuating this, Titanic that's already going down. We're just rearranging the deck chairs. So I hope that I can get this right. It's going to be a work in progress, because I'm not a graphic designer. I'm not a professional film person. I just want to get the information out. And I'm just going to, again, ask for your feedback as we go through this journey together, to help me understand that you got it or you're not getting it. And we can re-explain it a different way. We can tackle it however helps people learn. So with that, I'm going to sign off for this video. I look forward to going through this journey with you all and helping all of you understand the importance of this, and also empower you to understand how you can reclaim your health destiny. Until the next time.